experts to help us appreciate what the issue is and whether or not government should begin to take a second look at some of the measures that have been put in place, including the further easing of restrictions, which many are saying perhaps could be part of the reasons why we are getting such a significant number of people contracting the virus. Remember that Delta variant, we are told, is now in our various communities, which means that you and I are at risk, particularly if we do not wear our masks and if we do not observe social distancing. But there's more after this break. Stay with us.
What we do has consequences. Intended and unintended. The decisions we make, the actions we bring, have weight.
When did it become a crime to succeed in this country?
We spotted a suspect trading pattern. All three firms have links to Bobby Axelrod.
Be careful out there.
The game we love and cherish has seen players whose names specified in local headlines now become heroes idolized by fans. My name is Selwyn Saki, and I bring you fresher sports news,
Junior, who gets a run and scores.
Detailed analysis of the big names with your favorite pundits, both local and international, right on here on MX Big Sports. Highlights, interviews, features, and much more right here.
Striking and keeping clear of the other Red Bull.
Join me on MX Big Sports weekdays at 2 p.m.
This is magical to watch. I loved it. Oh, I loved it.
Again, World of Dance, another level. This could be one of the best moments of my life.
I need you to remember we're scoring out of 100.
Our first perfect score of the competition.
What questions are on your mind? Does partisanship permeate every aspect of Ghanaian life? Can Africans truly run their own affairs without a need for foreign aid? Do you have absolute confidence in the ability of security agencies to come to your aid when you need it? Do the emergency lines in this country even work? For answers to these and more, join me, Noang Falong, on MX24.
Right, many thanks for staying with us right here on MX24 television. My name is Kwabna Chenchaini Boati, and this is Opposing Views. As usual, you can watch on all our various platforms on digital. The handle is at MX24GH. I told you the conversation today is about COVID-19 and the safety protocols and how a lot of people are breaching the protocols, getting many to ask the question whether or not government needs to begin to review certain things. Now, let me take you to Medina Market because we have a reporter who is on standby and has been speaking to a number of market women as far as this issue is concerned. A number of them she spoke to are not adhering to the protocols. They are not wearing the face masks. Let's hear them. Okay, so that's a live footage from Medina Market where Dr. Sena Mafedo is currently located. We'll try and get her back on for a bit of an update as to the situation there. But as you could have seen or perhaps noticed from the footage we showed you a short while ago, the gentleman who was speaking was not in a nose mask. And he gave some very weird reason why he wasn't even wearing a mask. Perhaps we'll bring that to you later on. There was a lady behind him who had the mask but had drawn it downward to her chin, and so again she was exposed. Several others who were in the background were seen without masks, and it's getting a lot of people worried. I am worried again. But for those of you who perhaps do not see this as a big issue or a big deal, let me take you through something real quick here. Take a look at the numbers as we are going to share on your screen as far as the latest rates are concerned. Okay, so if you look at it, you can see that in the last few hours, we've had 382 new cases. 382 new cases. Okay, let's hold on to this and go back to Medina Market from where Dr. Sena Mafedo is engaging with a number of people at the Medina Market.
Everybody are there. So when I heard a number that they are counting that corona, these hospitals, so and so, I don't know where they are seeing the people, checking the people before telling us all those numbers. Nobody sick. Nobody tell me a friend of him is sick. All my friends are there strong. So corona, Ghana, we are free from that corona. You're welcome.
Now you heard it for yourself from the people live at the Medina Market. Some of them are saying they can't breathe in the mask, and some are saying they don't believe that the coronavirus exists. Reporting for MX24, and I'm Dorcas Apedu.
Okay, so you did hear the Dr. Sena Mafedo speaking to a few people at the Medina Market early on, and indeed it's something we all should be worried about when it comes to issues of health, issues of COVID. And we can all attest to the fact that we have lost friends, colleagues, family members through COVID. And so it begins to worry some of us when it's like, oh, there's nothing happening. Okay, like I was sharing with you a short while ago, the numbers are increasing, and they are increasing at a rather alarming rate. So take a look at the image I showed you a short while ago, where we had 382 new cases being recorded in the last 24 hours. There you go, 382 new cases. Now this means that our active case count has shot up to 2,858. 2,858. This puts our total confirmed case count to 98,817. And of all of this, the death toll has increased to 812. 812. And so it is not a situation where we need to be joking with it. Some way, somehow, though, the commentary a lot of people give is that, well, if the government appointees are doing it and the big men are not wearing the masks, why should we even bother? If you heard quite clearly what the gentleman on the footage had mentioned, he said, well, it is not the case that there's any such thing as COVID, because all his friends are intact. They are very strong. They feel very, very strong. There's nothing wrong with them. But take a look at this, though. I need to share this with you. Now, in the past few days, a lot has been happening. I want to share with you the data as has been put out. A lot of concern has been raised about the variant and all, and why we all need to pay attention to this. Now, as of July 9, we had 143 cases. July 9, 143 cases. And then we went to 228 on July 10. Then for July 11, it went to 158. All of them new cases, by the way. Then we had some significant numbers. We had 321 numbers as of July 13, and now 382 as of July 14. And that's what I just shared with you. And so clearly, we appear to be on a bit of a rise. Okay, let me now introduce our guest for today's show. And today we're going to have some very, very important health personnel join us. Dr. Justice Jansen is the General Secretary for the Ghana Medical Association. He'll be joining our conversation in a short while. Also, Harry Amwenin Ochre is the Deputy Secretary for the Pharmaceutical Society of Ghana. Again, Dr. Yabedi Akon, he is Head of Research and Advancement for WACPIP. Gentlemen, good afternoon. Many thanks for joining us on Opposing Views today. I hope you're well. I think I would like to start with Dr. Yabedi Akon, and I believe it's on now. Doc, can you hear me? Good afternoon. Okay, it appears Dr. Yabedi Akon cannot hear me. But again, like I mentioned today, we are focusing on COVID-19 and whether or not, we're asking that very key question, whether or not it's time for government to begin to review its combat strategy. Is the strategy even working to begin with? We have said, or we have seen a lot of reports suggesting that the cases in the hospitals are beginning to go up. There have been comments about how, for instance, the ICUs are getting full. Well, the health ministry has come out to debunk that claim. They say it is not true. There have, however, been reports attributed to the Ghana Medical Association that, well, a significant number of cases are coming through, and so it is not the case that people are not taking ill of the virus. And so we all need to really understand this and position ourselves in such a way that we do not hurt one another in a bid to get all of these going. So let's start off with Harry. Harry is the Deputy Secretary for the Pharmaceutical Society of Ghana. And for many of you who may have followed this whole thing, there has been a lot of issues, including the issue of vaccines, getting vaccines locally or producing them locally, or getting the Sputnik V vaccines from Russia through a third party, and it came with all of its noise and blah, blah, blah. There was concern about the efficacy of the Johnson & Johnson vaccine we're getting, as well as all the others. And so the conversation is a bit skewed in a way. But again, like I said, we are privileged that the Deputy Secretary for the Pharmaceutical Society of Ghana, Harry Amwenin Ochre, is joining us. Harry, good afternoon. Thanks for joining us in our conversation today. Okay, Harry's line 2 has just stripped, I'm told. It's rather unfortunate. I think today we may be having a bit of a challenge with our internet, but that's fine. We'll get it sorted out in the shortest possible time and have all of this brought to you. As we usually do, this show is a very interactive one, and so for those of you who are watching at home, in your offices, elsewhere, maybe you're watching even on your phone, feel free to share the links and tell someone to tell another person that, hey, Opposing Views is on. And today the key issue has to do with COVID-19. The key thing I hear a lot of people say sometimes is, as in, the virus is no more with us. It's gone. We've defeated the virus. We've gotten ahead of it. We've run the race. In fact, we've beaten it time and time again. So it's not something we should even be worrying ourselves over. Okay, let's get the views of the experts now. And Harry Amwenin Ochre is the Deputy Secretary for the Pharmaceutical Society of Ghana. Harry, good afternoon. Many thanks for joining us on Opposing Views on MX24 television. Harry, can you hear me? I think you may have to unmute. I see. Fantastic. Great. Now we can hear you. Great.
Sorry, I lost connection along the line.
Yes, you did. But we are happy you are back with us. Harry, there's a lot we want to talk about, but I just want to start with the issue of where we are now as far as the COVID numbers are concerned. You are someone in the health space, so I'm sure you'd understand this a bit more. Is there a reason for concern to begin with? That would be my first question. I have a few follow-ups still, but is there a reason for concern, taking a look at the numbers as have been put out by the Ghana Health Service?
Thank you very much. Yeah, the figures, updated figures as of this morning gives a lot of reason to be worried. When you consider especially the fact that we have recorded cases that can be attributed to the Delta strain in noticed recently.
Right.
And there is reason for us to believe that community spread has also taken place. We should remember that the Delta strain is more transmissible. In fact, official figures suggest that it could be 60 times more transmissible than the earlier variants like the Alpha or the Beta variants. And so when you consider that we have the Delta strain in this country, and you consider the fact that we seem to be relaxed with the protocols, right from the most influential people in the country down to the ordinary people, we are all relaxed with the protocols. And the fact that we have very, very low vaccination rates, we are not even getting the vaccines in the first place. As of the last time I checked, it's only about a little over 400,000 people out of a population of about 31 million that has been fully vaccinated. So when you combine all these factors, then yes, there is a reason for us to be concerned because the numbers do not look good at all. And the calculus or the trajectory as it stands now does not look good. We could be in for a very serious third wave if we do not sit up with the protocols. Thank you.
Okay, so let me ask this. I don't know whether you'd be the best person to answer this though, but because we know viruses mutate and we know the COVID-19 virus has even mutated for now to the point where we are even seeing the Delta strain and the like, do we say we stand at an even worse position now because, again, like you just hinted, we don't even have the vaccines in, and it has taken us this long to even vaccinate just about 300,000 or 500,000 people. And so is it that we are even in a more porous position than we were previously, and that things could even get way out of hand if we are not very careful and take a lot of pragmatic steps now?
Yeah, definitely. The nature of the nature of the Delta strain is such that we are in a very dire situation right now. But fortunately for us, the vaccines that we have available, if we can get them, has been shown to be effective at protecting us against these strains. So yes, the vaccine alone will not be able to do the job. But if we continue to observe the protocols that we have been told over the months that the COVID has been with us, then we can slow the progression. We can slow the spread and then allow the vaccination to come in. For the mutation, we cannot control the mutation of the virus, but we can slow it down by reducing the spread. And so there is a general demotivation among the populace to observe the protocols, but we shouldn't also sit back. We must continue to educate people about why they should take their lives into their own hands. Even though at the political level there seems to be some laxity, people are saying that because people in authority have gathered somewhere and then they didn't observe the protocols, they are also demotivated to do it. But people should take their life into their own hands and continue to observe the protocols. Otherwise, if we look at what has happened in India with the Delta strain, and if you look at how fragile our health system is, if the Delta strain becomes the dominant strain in this country, then we are going to have a problem because it can overwhelm our health system. And then there is also the risk of another more virulent strain emerging, which we can't also guarantee. So yes, we must be worried at this time.
Okay, you made a very important point about how we must educate people, or continuously educate people to get to know that the virus, we are not done with the virus, and perhaps we are in a particular stage where things could even be a bit worse for us. But my point is it the case that people don't know? Because I think a lot of money has been pumped into education. People have been told about the severity of the problem, but it still appears as though nobody really cares. So where is the problem coming from? Or people just feel okay dying?
Okay, so I see it from two different angles. The first one is economic.
Okay.
During the lockdown period, we achieved a lot of strides with respect to reversing the havoc that the pandemic has caused, because a lot of economic activities were halted. People were not moving out. There was less social mobility. Now, as I speak with you, there is general economic, challenges. We are in a dire economic situation. So the practicality of some of the protocols become very difficult.
Right.
So majority of the people in this country, the working class are in the informal sector. So you go to the markets, that's where most people are, go to the lorry stations, and they have to make money, they have to work.
That's true.
So it becomes challenging for somebody working in our markets to practically observe a 2 feet or 6 feet distance from another person. Our public transport system becomes challenging. So from economic point of view, some of the interventions become practically difficult. Then there is also a problem with leadership. Already people are demotivated to do it. And the people in authority who should probably lead by example are not doing it. So it affirms people's position that if COVID is indeed real, then why are these people doing that? Okay, so it has to start from up there. People in authority should demonstrate the protocols that we preach, and then, if possible, there should also be some kind of support. You know, there was the COVID-19 alleviation program some time ago, but as to whether it actually benefited the people at the base of the pyramid, the very people that it was meant for is another issue. So there's an economic point to it. People need to get out of work. So how do we? It's something that the government has to, sit down and then address. It's not people. Some people know very well the dangers ahead, but they also need to work. So we need to strike a balance between the two.
I see.
Thank you.
Okay. Let me come to what some of your colleagues have been saying, though, about how the government needs to support them to produce some of these vaccines locally. We heard that government had, through a committee, met with some of your members and a few others to try and see if we could find a way to get some of these vaccines produced locally, particularly considering all the impact of COVID-19, to the extent that we couldn't even import or export as much as we wanted to during the peak of it. What has become of that conversation? Are you aware?
Yes, I am aware a lot of discussions are ongoing, but we must understand that it's a long-term project. As we speak, no single country, especially in sub-Saharan Africa, could have the financial muscle as well as even the technical muscle to be able to produce the vaccines locally within the time frame that we have. We want to catch up. So it's something that we are looking at on the long term, because the COVID has taught us that we, at the point, as a country and as a people in sub-Saharan Africa, we need to make sure that we are producing most of our essential medicines requirements. Because during the COVID era, we observed a lot of disruptions because we import more than 70% of the medicines we use in this country. Where there were lockdowns, there were factory closures, there were a lot of shortages in this country. So it is like an eye-opener for us that going forward, we need to look at ways that we can produce our own medicine requirements, at least most of them. So it's a long-term thing, which it's doable. But in the interim that we want to deal with the current pandemic, I don't think that is practically possible. We are looking at it, yes, in the medium to long-term plan to be able to produce vaccines, and that can be done if the government can show a lot of political commitment and commit resources to it. That can easily be done.
So that means, as of now, we should not have any hopes that any vaccine we are going to get will come from within. We would have to hope or pray and hope that those elsewhere would have excesses for us to purchase or to even get for free before we can vaccinate people in Ghana. Correct?
Yes, in the sense that people are playing nationalism and geopolitics with the vaccines we have now, and looking at the way things are going, the widespread vaccination also appears to be the only way we can actually halt this pandemic. But the vaccines are not even available in the first place. So what we should do is we shouldn't overly rely on the COVAX facility. As a matter of urgency, as a country, we need to approach the bigger economies, the richer economies, and have some bilateral or even multilateral arrangements, and then purchase directly, whichever way. So that, because as it stands now, we have less than 2% of the population having received vaccination, and that doesn't offer adequate protection for the entire population. So we need to actually find a way. What we could do in terms of producing locally, well, the whole continent or the subcontinent could come together and probably gets a permission or some license from some of those companies producing it elsewhere, so that the exact thing will be duplicated here. You have the establishment, the machinery here, and the duplicated here. But to start from scratch and come out with our own vaccines and produce everything is something that is not achievable within the shortest time that we have. Okay. It's a long-term project.
Okay. Harry, final one before I let you go. On the issue of this COVID-19 spread, what would be if, for instance, you were contacted by government to give recommendations as to what we can do to immediately curb the spread? Because again, we've seen in the past 2 weeks or so a significant increase in the numbers. What would be your recommendation? Say maybe a three-pronged approach, but what would be the immediate thing you would ask of government or you would require of government in order to help curb the spread?
Okay, so I think first of all, we need to continue the public engagement in the public education. We need to continue to let people understand that the pandemic is still raging on and it's not over yet, and so people should continue to observe the protocols. Then another thing I've observed also that initially, I think the government should treat this new wave just like it treated when the pandemic started. I've observed that so many of the corporate institutions that were having Veronica bucket, people washing their hands, some of them have taken them away, some are not available and all that. So the government we need to reinforce that anywhere we have people gathering, there has to be resources for people to wash their hands. There has to be resources for people to sanitize their hands. And now we thank God that the price of the mask has also fallen drastically. So the government can support people in markets, in the informal places, to also, distribute them. And then we also continue to educate people on the correct usage. I think that's also one issue that we have taken for granted. Some people are using the mask, but are not using them properly, and that could even be spreading the coronavirus. Then the government should also do whatever it can to make sure that we get the vaccines, and once we have them, initiate a widespread vaccination program so that most of us could be vaccinated. There is no magic to it. The same protocols that we have been taught all this while, we make sure we continue to observe them, and then we make sure the vaccines are available, and then we take them, and we believe that this could halt the process.
Okay. Harry.
And then a quick one. At the same time, at the same time, what is also very important is that the cases that will finally come in, we should also be prepared to handle them. So whether we have enough of the therapeutics, enough oxygen supply, whether our emergency units are also ready to handle the few that will come in, is something that the government should also be looking at. Okay. Because we should be prepared. If current trends continue, then we should be looking at higher number of cases. And once the number of cases go up, then we are going to have more people being hospitalized. And once more people are being hospitalized, we are going to need these things. So I believe these are the things that the government can do.
A lot of people have been talking about maybe scaling back on the further easing of restrictions and the like. Is this something you would also recommend, that perhaps we need to tighten these restrictions a bit more so that cinemas that have been open, beaches that are open, and a few other places that are open, maybe we have to pay a bit more attention to that also? Would that be a recommendation we should pay attention to?
Absolutely. But I'm still looking at how the implementation has been. You know, the fear for the COVID during the early days of the pandemic is not the same now. Yeah, so it was easier. If you tell people to organize funerals with 25 people, people were more likely to abide by it. Currently, you saw in the video you showed me, people believe that the COVID is not even real. And so people are just not motivated to follow those restrictions. Right. And you can't continue to go and arresting people. I'm not going to do this. We arrest people who observe people and all that. So it's very important restrictions on funerals in terms of the number of people. It should only be held in open space and the distancing and all that. But the people in authority must also demonstrate leadership. And that will actually motivate the ordinary person to also follow. So we can also, in terms of the marketplaces, there was a rationing system that was brought up along the line. We could reintroduce that so that in the markets, maybe it could be rationed, because when the fire happened at Eden Makola recently, and I saw the pictures, I was like, wow. Apart from the fire itself, there was no room for any COVID-19 protocol at all, and it's worrying. It's worrying. So yes, some of those restrictions should be brought back until we are in a position where we say that the disease has been well contained.
Okay.
Thank you.
All right, Harry, many thanks for your time today on Opposing Views. We are really grateful you took time off to join us. Harry Amueniotri is the Deputy Secretary for the Pharmaceutical Society of Ghana. You heard him there say quite a lot. We are expecting a lot from government, but we ourselves must also pay a bit more attention to how we handle certain things. You cannot walk around thinking that COVID is a thing of the past. It is not. Even in more advanced countries where they vaccinated some 70%, some 90%. In fact, I think I read I read a publication about one country which had vaccinated over 120% of its population. Yeah, you're surprised. Yes, because it's a country close enough to, it's a very small country and a lot of people come there. So when you go in there, they make sure they vaccinate you fully. So when they did the statistics, they had finished vaccinating everybody in the country, and 20% more as in people who had come there to for tourist activities. And so perhaps we also need to pay a bit more attention to some of these things. This is still Opposing Views right here on MX24 television. We're going for a quick break. When we come back, we'll be joined by some persons from one of the health centers. They've been doing a lot of genome sequencing and the like. They are the ones who came to us and told us that the virus, it is some way, it behaves in a certain way, it can mutate, it can change this, it can do all of that. And so they will join us in studio, and then we can have a bit more conversation about this and a few other things which are coming up rather strongly in this short period. Stay with us. We'll be back shortly.
"46 films, 24 countries." It is the third edition of Accra Indie Film Fest, the Power Edition, from the 20th to 24th July. It's going to be an amazing week of film screenings, musical performances, film conversations, and so much more. AIF Awards Night and closing ceremony on 24th July 2021, exclusive on MX24. For more information, visit www.accraindiefilmfest.org.
The game we love and cherish has seen players whose names first hit local headlines now become heroes idolized by fans. My name is Selwyn Saki, and I bring you fresher sports news,
Junior, who gets a run and scores.
Detailed analysis of the big names with your favorite pundits, both local and international, right on here on MX Break Sports. Highlights, interviews, features, and much more right here.
Striking and keeping clear of the other Red Bull.
Join me on MX Break Sports weekdays at 2 p.m.
It was just magical to watch. I loved it. Oh, I loved it.
Again, World of Dance, another level. This could be one of the best moments of my life.
I need you to remember we're scoring out of 100.
Our first perfect score of the competition.
What we do has consequences, intended and unintended. The decisions we make, the actions we bring, have weight.
When did it become a crime to succeed in this country?
We spotted a suspect trading pattern. All three firms have links to Bobby Axelrod.
Be careful out there.
All right, many thanks for staying with us right here on MX24 television. Like I said, this is Opposing Views. My name is Kwabna Chenchen, and I'm grateful that you've taken time off to join us yet again. We've been talking about COVID in the first half hour of the show, and we are still going to stay on COVID and stay on other issues relating to health because it's of paramount interest to you and I. As you can see, I'm in my mask now because I've been joined by guests in the studio. And so as much as possible, the protocols that have been preached, please, I say again, try as much as possible to adhere to them because your lives matter much as mine does. If I go ahead with reckless behavior and I contract the virus and I go and sit in a trotro, the likelihood of me transmitting that virus to several other people, innocent people who may even have friends and family at home with less immunity, could also end up passing it on to them. And then in the end, we may not hear such good news. And so as much as possible, let's adhere to the protocols. But at this time, though, let me introduce my guests in the studio. They are from WACBIP, and those of you who know them, you know that they've been doing a lot of things about research, about genome sequencing, about this, about that, all things related to health, research and health. And so Chewe Kioma is the public engagement officer for WACBIP. She's joining us in the studio, as well as Molly Aban, an MPhil fellow also at WACBIP. Ladies, good afternoon. Thanks for joining us.
Thank you for having us.
So there's a lot we've been talking about as far as this whole COVID thing is concerned. But you also walk around sometimes in the market. Do you see people wear the mask at all?
Well, that's an interesting question. Thank you very much. And I think recently I was at the Medina market and you hardly see people wear the masks. I mean, just recently, Alinda was at a show at the University of Ghana campus where most people weren't wearing masks. So I think it's a national issue, but I think with education and more sensitization, people will definitely
What should be the message? If we are to educate people now, if we are to craft a message, how should we go about it? Because some say people are no longer scared of the virus. That's how come they've thrown caution to the wind.
Well, I think we need to gear up. We need to man up. So, for instance, my work as a public engagement officer for WACBIP, we've been undertaking seroprevalence studies in some markets and then some lorry stations across Ghana. And usually, when we meet people who are interested, when they see us as research scientists, they are interested to know everything about COVID.
Right.
So when we meet them, we tell them, we give them this African proverb. If you think you are too small to make a change, try spending a night with a mosquito. So people actually get to know, even though you might think it's far away, but it's very close.
Closer than you think.
If in case you are infected, everything will be different now.
It's good. And you've actually even gone ahead of me because I was going to ask you a certain question about WACBIP. You spoke about some of your engagement and the like. So what do you do? So for the many people who may be watching, maybe seeing you for the first time or hearing about WACBIP for the first time, what is it exactly that your organization does?
Okay. So WACBIP is a big institution. So we are one of the biggest biomedical research institutions in Ghana, Africa. And we are supported by a World Bank initiation under the African Center for Excellence project, also with little support from government of Ghana. So we train, so for instance, someone like Molly is an MPhil student, so we train people from all over Africa, and we've trained over 90 PhD students, over 160 MPhil students.
We'll get to that.
And we have also trained, we also have postdoctoral fellows, about 20 of them. And we still get people engaged in some of the research activities that we do. We do COVID, for instance, as you said. Molly here is doing Yeah, antimicrobial resistance. And
Okay.
we also have people working on hearing impairment and deafness. We also have some of our fellows doing malaria research, HIV/AIDS, tuberculosis, all kinds of infectious disease and non-communicable diseases.
I see.
There, yeah.
I see. Molly has been nodding a lot, and yeah. Molly, why did you choose WAGPIP? Why, of all the places, of all the, why WAGPIP, and what has been some of your experience over the period?
Okay, so it wasn't necessarily why WAGPIP. I was already within the department where WAGPIP is currently present.
Okay.
So I was a student at biochemistry department. So based on the research I observed being conducted at WAGPIP, I decided to be a part of that program. So it was more of a straight journey from undergrad to internship with WAGPIP and then being a student.
So what's your area? What's the research area you're working on? And are there even quite a number of people pursuing such things?
So my research area is antimicrobial resistance.
Take your time.
Yeah.
Over here. Anti what?
Antimicrobial resistance.
Antimicrobial resistance.
Exactly. So this one is described
what
as
in God's name is that?
Antimicrobial resistance. Yeah. So it's a silent pandemic. It's not like the COVID, but it is an issue globally. So antimicrobial resistance is when you are treating, whenever you have your pathogens that are causing infections, being able to resist the drugs that are being used for treatment. So in such a case, your drugs are no longer effective. So all the research, all the pharmaceutical drugs that are present within the system for treating particular infections are no longer effective. Yes, so that's basically what my research
Okay,
is.
you have confused me though, but you hold on briefly. You just heard from Molly Abanda. She's an MPhil fellow with WAGPIP. We've been talking about COVID and a few things that has to do with health as well. It's been a very interesting conversation so far. She's saying something about antimicrobial something resistance, and the like. I think she will take us through that a bit more. But as you're watching from home also, if you have some comments you want to share with us on today's show, remember that you can check out any of our social media handles on Facebook, on Twitter, Instagram, and even on YouTube. The handle is at MX24GH, at MX24GH. Just go there, put your comment there. We'll likely share it with the rest of the world. We can share. You can also go ahead and share the streams. The live streams are up now and running on all of the platforms I've mentioned to you. Again, we may open the phone lines, depending on how this goes. We may open the phone lines and allow you to also give your suggestion as to what it is you expect of government in this rather critical time. For a number of people, they say, Charlie, we need to begin to tighten the restrictions. Let's not ease the restrictions. Let's tighten it a bit and then manage it, gauge the situation. If it gets better, then we'll look at some other things. Mind you, there was talk about how the Delta variant thing had gotten hold of a few students at Achimota School. We had been told also that that school had been put on lockdown. Some way, somehow, I happened to be around Achimota School sometime over the weekend, and I passed by and I saw quite a number of students also passing by. As to whether this was a different form of lockdown, I don't know. But our news team is on this beat, and so we'll be bringing you updates on that subsequently. So please, as much as possible, let's stay safe. Okay, back to Molly. Molly, you say the area, your area of study has to do with, I just need an example. So, something we can relate to.
Exactly. Okay.
Not malaria.
So I was going to use a malaria example.
Okay.
So in terms of, previously malaria was treated with a drug called chloroquine.
Chloroquine,
I realized that chloroquine is now it's no longer effective against
its efficacy has gone down.
Exactly.
Okay.
So that's what my work is looking at. But in this case, it's not malaria exactly. It's on bacteria.
Some bacteria.
Yes.
I see. Interesting. There's a lot more we have to come to as far as some of these things are concerned. Okay, so back to Madam here. So you tell us a bit more about this research you people speak of and what is going to entail this time out.
Okay, so at WAGPIP, we don't only do the research. We communicate. I mean, science is best done when it's communicated. So we have, every year we do gather all our research scientists, both internationally and then locally. They come together, then they share a platform, giving to them, share the various processes of their research, the outcomes of their research in a whole lot. So this year's research conference it has a theme which is also associated with COVID-19.
But you are the ones who did the genome sequencing
yes,
for us,
yes,
right?
definitely.
Charlie, kudos, congratulations. You
Thank
did a good job.
thank
Fantastic.
you.
You know, but the virus is still at us anyway.
Yes,
But
yes.
okay, you go ahead.
So we want to share lessons on COVID. I mean, so far we've done a lot of genomic sequencing. We've done over 900 genomic sequencing so far, and then we are still conducting some, even with seroprevalence engagement and outreaches. We are resuming most of these things around. So our research conference basically gathers everything together. We share lessons from COVID, and we are bringing in top-notch speakers, top-notch scientists from across the globe, and then in Ghana here to speak. And we also have our research scientist, someone like Molly, to also share her experience.
Molly, so yes, she's been saying a lot about some of the things WACPIP has managed to do, which I think are quite significant, particularly when it comes to the issue of the genome sequencing. When I read that document, I was really, really impressed. I said, okay, this is good, right? But what are some of the major achievements of WACPIP so far?
Okay, so WACPIP has, I'm able to put all
together. Oh no, you can't list all. Just give us a few, so people can begin to understand or appreciate things from my perspective.
Until the introduction of WACPIP, it looked like research into the various diseases we have in Africa was limited. So looking at something I'm doing, which is antimicrobial resistance. Currently in Ghana and let's say in Africa, much work is not really focused on studying the bacteria that we have within our hostile environment. And this is really worrying because of the something known as hostile acquired infections. So one of the things that WACPIP did was to train PhD students. So these students undertook different projects. So one major project was looking at the hostile environment and then the bacteria that we have circulating within those environments. So from this, we have our students who are training other students. So it's more of, WACPIP is more of a capacity building center. So based on the research of one student, we was able to train other students who are now leading different fields of antimicrobial resistance. So it's now like something that we are trying to implement is like focusing on policy implementation of some of the research that we are doing. So that's what WACPIP is currently doing. That's one of the major achievements of WACPIP, looking at policy implementation of our research.
You mentioned the thing again, antimicrobial something. Okay, so like you mentioned, you are doing you are in a niche area. 10 years from now, how do you see this work of yours impacting lives of society?
Okay, that's a good question. So with the work we are doing, because much knowledge is in Ghana, the data on this is very scarce. We are hoping that based on the findings we are going to get from our research, 10 years from now, our work is going to be more of a policy implementation kind of work, something like that. So something like we were able to tell people that the drugs that we are using, we have to be able to relegate and control the drugs that we are using. So you can't just go to a pharmaceutical company, you can't just buy drugs off the counter. You need to be, it needs to be more of a prescribed, it's a policy guiding drug usage. It's a policy guiding testing. It's like that's the whole idea. Like in 10 years now, like more policy-driven research.
So that is like elsewhere. You can't just go to a pharmacy in say the United States and just say, "Give me painkillers." You need a prescription.
Exactly.
And you're going to create problems for us.
But we don't exactly create problems, but it's supposed to help reduce
abuse.
Exactly, that's the word. Yeah, it's supposed to help regulate abuse of these drugs that we have, because it takes a lot to produce a drug for it to then be ineffective against an infection.
Right. So something like tramadol.
Exactly.
And now people have abused it.
Exactly.
It's supposed to be used for a particular thing. But now it appears to be a sex enhancement, whatever.
Exactly. Because it's easy to get on the market. Something like that.
Okay, so to all of you tramol lovers, the end is nigh. If you want to stock up, please do. Okay, so focusing on WACPIP and the program you speak of, what it is you are doing, share with us what the theme is and what is expected of the general public or persons who may be interested in such material, so we could wrap it up.
Okay, so the theme for this year is building sustainable capacity, in Africa. Lesson from the pandemic, basically, yeah. So just everything about the pandemic, share lessons on it.
Okay,
You know.
I'll ask you one thing. Your major takeaway from this pandemic?
Okay, so one thing for me, I have learned from this pandemic is for government to invest in research, especially
You don't think there's
work.
enough investment in research
There
in
is
Ghana?
not enough. So I can give you an example. So currently, most of the grants that we are working on are all from foreign donors.
All from foreign donors?
Yes, all from foreign donors.
Currently, but I thought they were giving you some of the SBSH money.
No, we don't. So from Welcome Trust, from World Bank, from other institutions. So basically from the taxpayers of people in the UK or in the US. So that is what we are working on, using the money that we've gotten to work on the research that we have. So one thing I've learned is government should support research.
Right.
Currently, there is this research fund bill which is still pending in Parliament, which hasn't been approved yet, or whatever is taking it. We want to give so that it won't, in case there is another pandemic, we won't be taken by surprise, whereby we'll be looking for this, doing this. No, we just need to have everything in place.
Okay, Molly, I'll ask you the same question, but just in a bit. I need to announce the phone line so that we can have our viewers also join us in this rather exciting engagement. It's 020-473-8481, 020-473-8481, and 055-033-1511. The key question on the table has to do with what it is that government must do to curb the spread of the virus. And as I mentioned to you and as I showed you early on, the numbers are increasing rather steadily. Now we are at 382 new cases in just 24 hours or so. That was as of July 14. That's the latest update. 382. Quite serious. But what should be the best approach? Is it that we should go on another lockdown? Should we, I don't know, say we are further tightening the restrictions? Should we say there has to be a partial lockdown or whatever? That's it. You can see the 812 deaths, 382 new cases, and 2,858 active cases. And again, let's not joke with this. But what will be that recommendation to government? What should government do? Another lockdown? Or what else? We don't know. But 020-473-8481, 020-473-8481, and 055-033-1511. We'll take just about 2 calls, and then we'll wrap up today's show. We have Molly here. Molly is an MPhil fellow with WACPIP. She's just about sharing her experience with COVID with us and her takeaways from it. Molly.
My experience with COVID, I wouldn't necessarily say I've got COVID because I don't think I've got COVID.
You don't think you have?
No, I haven't got COVID because there are a lot of implementation processes that we go through at WACPIP when we are within our environment. Yeah. So my takeaway would be that it is real. People don't believe that COVID exists, but it really does exist. So until you are affected by the virus, you will not pay much attention to it. So I want to say that all the protocols that have been put in place by the government, like that's what we should be following. Like that's just what we should do. All the protocols that we put in, and we should also have a sense of responsibility, each individual, because the government not necessarily be there to check that you are following the protocol. So it's up to you, the individual, to think about yourself and the next person, and then just protect yourself.
Okay, let's go to the Ashanti region. Our first caller, Foyo, is on the line. Foyo, hi, good afternoon. Foyo, hi, good afternoon.
Yeah.
Right.
Yeah, good afternoon. How is it?
Very well, thank you. Let's hear you, sir.
Yeah. It's a question that I want to ask.
Sure, go ahead.
Yeah, I want to know really, is it the COVID, is it really existing?
Yes, please. It is very real. COVID is very, very real. And a number of people have actually lost loved ones because of this. And so it is very, very real. So I'm glad you asked this question because it gives us an opportunity to let people know about how real this is. But thank you. Thank you very much for your calling us from the Ashanti region. Let's go to the Upper West Regional Capital, Wa, from where Adam is joining us. Adam, good afternoon.
Good afternoon.
Let's hear you, Adam. afternoon. Let's hear you.
Is a suggestion that I'm bringing on to
let's hear you.
whether the lockdown should be done or people should just be moving on with their normal activities. The lockdown, it is not necessary for lockdown to be done again. What is necessary for us now is to implement the protocol so that the protocol will be working effectively.
Okay, Adam, if you could turn down the volume of your TV because we are getting some really, really bad feedback at our end. If you just turn it down and just listen to me on the phone, right?
I've done that.
Fantastic, thank you. So you are saying that you are not convinced that something like a lockdown will be in the best interest of the country. We should rather focus on adherence to the protocols.
What is necessary now is they should implement a serious law into the protocol so that people can be going by it.
I see. Okay. All right, Adam, thank you very much for that update. That was Adam from Wa. Let's go to Ashaiman. I didn't get the name quite right. Our friend from Ashaiman, good afternoon.
Good afternoon.
Yes, sir. Let's hear you. First, your name, and then we can hear your views.
My name is Moro Garba.
Moro Garba. Fantastic. Let's hear your views, sir.
Yes, I say, they talk about the COVID-19 alone, they kill. More sickness day than they kill people, not the COVID-19. Typhoid day, yellow fever day, cholera day. Now, that was all. Nobody will talk about it. Only COVID-19 alone, they hear about it.
Okay.
That's what I call prevention. And then the COVID-19 alone be the sickness ready for the world inside now.
Okay.
Thank you.
All right. Thank you, Moro. Moro called us from Ashaiman, and he gave us that rather insightful point there that, yes, it could be the case that COVID is real and is creating a lot of harm, but also there are several other sicknesses or diseases that we need to equally pay attention to. We'll take one final call, I believe. Okay, I'm told we've run out of time. We can't pick any more calls, I'm sorry. But a few comments here that I will just read rather briefly. One from Moses Youngzigi says, opposing views is such a great show, very informative. Moses, thank you for that. And Mr. J has two messages here. First one says, the reliability on the COVID-19 vaccine can't guarantee COVID immunity. It prevents you from getting COVID-19 again and prevents you from becoming an asymptomatic carrier. And then he adds that, so the government should really review its strategy and come out with something to fight this virus. Okay, I'll take final words from our two ladies in here, and then we'll wrap it up right here in 30 seconds. Any word? 30 seconds. Yeah.
Okay, so at Wagbe, we are excited to invite everyone, the public, both virtual and then face-to-face for our research conference. As Moro said, there are lots of diseases and sicknesses, around us, and we are inviting people to listen. Follow us on our Twitter page and at Wagbe UG, on Facebook, on YouTube. We will be everywhere from Wednesday to Friday. So if you want to get a best of science, just join us as we celebrate science during this week.
Okay.
Yeah.
My name is not Moro, but I'll act like Moro right now. My name is Kwabena Chencheni. Thank you for taking time off to watch today's episode of Opposing Views. As we always say, as much as possible, stay safe. The show was produced by Marie-France Fojo, Jonah Eledi, and Ernest Senanu Dovlo. I'll see you on Wednesday. Hopefully, we'll all be healthy. We wouldn't have caught any virus. Many thanks for watching.